Finding Your Way with Ocular Melanoma, join me, host Tara McCannell, as I share with you everything that I know about this rare cancer. I hope you will learn, get your questions answered, and be motivated to empower your own healing. Visit my resource page, sayhart.com/ocular melanoma. That's SEYHART/ocular melanoma for more content and support. Today, I'm going to answer the question, how can acupuncture help someone with ocular melanoma? First of all, let me explain to you why I am so passionate about acupuncture and other complementary ways of improving our health. Let's step back even further from ocular melanoma, from different ways of managing our health, but let's look at what is health. Our health is not just the makeup of our body, our organs, our vision. It includes our mental and emotional health. Health is the state of everything. And if we want to improve our health and to further our health, to give ourselves the best opportunity to do physically well and beat cancer, get stronger, conquer our diseases, be the best we can be, we have to include it all. One of the issues that has occurred to me over the past decade or so is that as a practicing Western physician, my scope of the ability to help people is so limited because, extremely limited, because I'm focusing on the eyeball, your vision, and it has occurred to me over the years, helping patients, helping people with all sorts of ocular problems and diseases, that all of this happens in a context. And if we don't stop to pay attention to what else is going on to our patients, what else might be influencing decisions that they make that added together will influence their care, we are not really looking after people. We're not looking after people. We're looking after the organ. We're making sure the tissues are in order. We're adding our expertise in all the things that we know about how the eyeball and vision works. But we must include the rest of the person. And the rest of our health includes mental and emotional health. I want to talk a little bit about how important our brains are in our health. You know, we don't even think about our minds and our brains that much because much of the work that this amazing organ does in our bodies is automatic. It happens in the background. We don't even think about the complex interactions and, frankly, the mysteries of how our brain controls our entire body. There is so much more emerging research that shows that our thoughts, how our brains work, influences chemical reactions, influences nervous system regulation of everything, of every cell in our body. So if we want to do all we can to be as healthy as we can, to strengthen systems in our bodies that are designed to help us and to protect us, we must consider our brains. And when we think about our brains, what does that mean? What can we really do to control what goes on up there? Well, it turns out that there's a lot that we can do. And it starts off as simply as our own thoughts. Many of us have thoughts in our heads that, again, are just automatically there in the background. We have thousands of thoughts and opinions and emotions and things that happen every single day of our lives. And each one of these thoughts causes a very slight chemical reaction, a manifestation of some physical pathway in our body. We don't talk about this much in medicine because, for the most part, traditional Western medicine may not be able to address our thinking and our mental and emotional health. However, we do know that a person's mental health, when we think of how strong we are emotionally, does play a huge role into how people do with their disease. So when people have more depression, anxiety, and other actual medical disorders that can affect our brains, this changes clinical outcomes. And there is research in all sorts of areas of medicine that confirm that when our brains and minds are not healthy, meaning they have reached the level of clinical disease, it changes our health outcomes. So just knowing that what goes on in our brains and the state of our emotional health plays a critical role in our physical health, we need to think of ways that we can bring our emotional health together with our physical health. And again, you will not likely have this discussion with your ocular oncologist. You might not even have this discussion with your primary care physician. It's very difficult in our scope of the way medicine is practiced today to have all these concepts addressed, supported, to be given advice on how you could be doing better. So, what are we to do? Well, it starts by educating yourself. What can you do to improve your mental and emotional health and your brain health? Let me tell you about how complementary medicine and complementary approaches to our health can help us harness this sort of mind-body connection. And when people talk about a mind-body connection, unfortunately, it's still couched in, oh, this is pseudoscience, but actually there's a lot of data. And I have become personally acquainted with a lot of this research as I've myself learned a lot about this area. And these things, this knowledge, we can use to help us. So first of all, I want to share with you how our nervous systems work. How is the brain connected to our physical body? And what I am about to tell you is definitely by no means the complete picture, but it represents what we do know about how our minds and bodies are connected. In our brains and in the functioning of our brains, we have an autonomic nervous system. The autonomic nervous system is the whole entirety of the synapses, neural transmission that occurs throughout our bodies, and it happens automatically. It's voluntary. We can't do a lot that we know of to change this. The autonomic nervous system is made up of our sympathetic nervous system and our parasympathetic nervous system. And both of these nervous systems regulate different pathways and almost opposing pathways. What is the sympathetic pathway? Our sympathetic nervous system is in charge of fight, flight, or freeze. As human beings, we have evolved our sympathetic pathway as a survival mechanism. Thousands of years ago, when humans were earlier in their evolution, people who had a very robust sympathetic pathway that could turn on and result in fleeing from danger, building up so much energy that we could survive life-threatening situations. These are the humans that survived and evolved and passed on the genetic material with a robust sympathetic nervous system. And today, we still have these features that our more primitive selves needed in order to evolve and exist. So we have a sympathetic nervous system that is ready to protect us from imminent danger. On the opposite side, we have our parasympathetic nervous system. And this is the aspect of our autonomic nervous system that regulates rest and digest, functions that are needed to maintain ourselves and that we do not draw upon when we're under urgent, stressful, life-threatening conditions. So we call this a lot of rest and digest. The parasympathetic nervous system kicks in when we are relaxed, our digestion picks up, so we absorb nutrients from food better, our heart rates are lower, our breathing is slower. Contrast that to the sympathetic nervous system where we have elevated heart rate, our breathing is faster and quicker, and our blood flows rapidly, and all the blood that goes to digesting food redirects to supplying oxygen and perfusion to our periphery and peripheral muscles so that we can run. So when we're under duress, we are not calmly digesting our food. And another topic can be about how this nervous system regulation can significantly impact our digestion and GI systems, but we'll talk about that another time. So we have these two opposing systems that need to be in balance. And can we do to help encourage more of the parasympathetic responses versus the sympathetic? Because when the parasympathetic nervous system is activated, the body is doing activities to support itself, to maintain itself, but not to act in response to life-threatening situations. However, the sympathetic nervous system is often more activated and more sort of the reins are shifted to the sympathetic nervous system when people have constant anxiety, who are under constant stress, and who have situations that have made them shift to this less favorable, more acute and reactive nervous system. So there are some things that we can do to help encourage actions and functions in our parasympathetic, because if the parasympathetic nervous system can flourish, or we can support that part of our autonomic nervous system, we have stronger immune system. We have lower cortisol or stress hormones in our bloodstream. We have more building of systems and repair in our body. And we also are more relaxed and more calm. A few simple things that you can do to activate your parasympathetic system are: number one, slow, deep breaths. When you breathe slowly and deeply with intention, you stimulate your diaphragm. Sometimes we call this diaphragmatic breathing, and that stimulates your parasympathetic nervous system because your vagus nerve, which is the longest parasympathetic nerve in the body, is connected to the diaphragm. So when you take slow, deep breaths, you activate the parasympathetic nervous system. There are other activities that also encourage parasympathetic activity. Another is meditation. Meditation is simply pausing and doing activities that make you aware of the present moment. When you pause and do this, you actually calm your sympathetic system, and your autonomic nervous system switches more to the parasympathetic route. And you can be aware of the present by simply going through your five senses. Each of your five senses, stop and think, what do I hear in this very moment? What do I feel? And go through your body. These activities bring you to the moment. They take you away from the rumination that may be going on in the back of your brain. So I encourage everybody who has thought about how meditation might help them to just start. Start today. Little things that you do at this moment will have huge cumulative effect 5 years, 10 years down the road in your health. So how does acupuncture work in all of this? So when people have acupuncture, actually, let me tell you a little bit about acupuncture. Acupuncture is a thousands-year-old tradition based in Asia, where fine hair-like needles are placed in certain points in the body. According to Chinese traditional medicine, you have meridians. These are energy connections that connect areas in your body, different systems. There are different channels that exist in our bodies that help regulate how our bodies work as a whole. This is very much unlike traditional Western medicine, which is based on anatomy, pathology, function. This is something that has been present for many years and that practitioners of acupuncture have used, and have used with great success. The principle of acupuncture and helping people with this is that acupuncture doesn't just fix an organ problem. It addresses the root cause. It helps balance energy that may be stagnated, meaning it's blocked. It helps move energy. It helps move motion of energy, which we call in Chinese medicine our qi, or life force, through these meridians in the body. When we encourage the flow of energy in the body, This helps us achieve a state of balance. It helps encourage parasympathetic nervous system responses. So when you go, if you've never had acupuncture before, I strongly recommend that you give it a try. When we think of acupuncture, most people think of, oh, that might help with pain or a problem that I'm stuck with. But actually, acupuncture is the most effective at improving mental and emotional health. And if, some of you may know that I do have an acupuncture clinic, which I help oversee in Los Angeles. And we have seen incredible benefits when people come with mental health disorders. And we don't have to wait till you have a clinical diagnosis of depression or generalized anxiety disorder. The beauty of this is that we can start doing things preventively, or if we feel that we're a little bit off, we can start having sessions and treatments to help align and balance us. And the reason why this is so important, not if you just have ocular melanoma, but that you have everything, is that why not work on improving every system in your body? By improving the energy flow, by encouraging parasympathetic responses, by doing exercises that help calm your brain, you will change the physiology of everything happening in your body. There, as I mentioned before, there is emerging science that shows that when we alter these pathways neurologically by these activities, we change outcomes of disease. We see improved markers of our immune system. We see fewer incidences of colds and flus. We see better health outcomes in certain conditions. So why not do something where you involve your whole body? So the question is, how do we start doing this? You know, if you've never gone to a complementary physician or sought out alternative approaches, how does one begin? Well, first is just getting educated, learning about this. Acupuncture and complementary approaches do not replace your traditional Western care. The idea is that they work alongside, because if you have more things to help support you, you're going to do better in the long run. So it's important that a complementary doctor or an acupuncture practitioner be of the mind that they are accepting of the care that you are receiving with your primary care physicians. There are far fewer ophthalmologists or specialists in medicine in a given specialty than there are the thousands of people who practice acupuncture, naturopathic medicine. It is a very, very broad area of people who do complementary approaches. And for many of us, including me, before I started understanding this better, is that there's naturally an element of doubt. Much of this is not as regulated as in Western medicine. So how do we know who we're going to? Well, that's why, just as you would as you're looking for physicians, you would do your research. You ask questions, you ask friends, you ask your primary care physicians or your physicians who they would go to if they were looking for someone who was a quality individual who is going to support you in your care and not try to replace all the doctors looking after you. Complementary people who take care of patients come from a wide variety of backgrounds. So just a warning, you must, just like you would in anything else, you must be critical and ask questions, and it needs to make sense. So you do your research and you find someone. And for most people, going to a complementary physician or an acupuncturist, weekly sessions is extremely helpful. Or you can try every other week. But it's important to note that oftentimes noticeable benefit doesn't happen right away. It takes time for your body to readjust itself and start utilizing other pathways. And in particular, I mean other neurological pathways that will support your physical health. And I feel that if you're dealing with something where there's a lot of unknown, such as ocular melanoma, well, we do know quite a bit. We know risks, we know vision related things, we know more and more about being able to predict mortality and metastasis. There still remains a lot we don't understand. There are still people who beat the odds. There are people who, or on the other hand, who may succumb sooner than we thought. So why not bring together other approaches to support our health so that we can help influence some of the unknown? And I feel that thank goodness that there is some unknown, because that gives us the opportunity to really engage in other ways to help support our health. So adding a complementary approach to your health, such as acupuncture, which I'm passionate about, there are other avenues as well. There are other types of complementary medicine. And of course, there are the basic things that you can do to improve your holistic health, such as making sure that you exercise, making sure that you have a good quality sleep, making sure that you are monitoring your eating patterns, your diet, your weight, and being very intentional about it. Understand why you are one way or the other. A lot in medicine has quick fixes like medications you can take to stop and cut your appetite. Why don't I always encourage people, before we jump to the GLP-1s, why don't we pause to understand, why are we moving along this path? For example, why are we suffering from obesity, or why are we having trouble sleeping? The more we understand and really look inward and be open to other ideas to support our health, the more we're going to learn about ourselves, and the more responsibility we take back for ourselves to become better. And in the setting of a diagnosis of cancer, this is the perfect wake up call to really stop and look and see what you can do to improve your entire life. And I encourage you, don't just go to your appointments and follow ups and do what your doctors say. Learn about things yourself, explore other avenues, be open minded. We don't know absolutely everything there is to know in Western medicine. So take this as an opportunity. Try other things, bring other avenues into your life to help support your health. I hope this has been helpful. Thank you.